For the standard papilla sling, we have papilla that are released on the buccal, either from soft tissue grafting, we want to do a coronally advanced flap, or maybe they're simply part of a larger flap that extended posteriorly, and we want to put the papilla back. Our first bite is going to be at the base of the papilla, not at the tip, but at the base of the papilla, and we'll go underneath the contact point as well, without engaging the lingual tissue. We'll pass the needle through, and then when we retrieve the needle on the lingual, give yourself a little bit of slack and immediately pass the needle back underneath the other contact without dropping it. We'll take the needle through the other facial without biting any papilla. Just get rid of some of this slack. Our second bite goes through the base of the more mesial papilla and back under the contact without biting the lingual tissue. We can then feed this through the lingual, and without dropping the needle, you can pass it right back through the previous interproximal space. Get rid of the slack again. And what you notice is that the suture entered this papilla, slings around the tooth, entered this papilla from the facial, slings back around the tooth, and now when we tie this, it's cinching the tissue back to the facial of the tooth. So we'll do our simple surgeon's knot. And depending on the suture you're using, you may throw several more knots. But for our example, we'll end here. And that is the simple papilla sling.